A lot of talking points, and that's one talking point that through this campaign, again, we do feel very confident in the signatures that we turned in. Julie Parrish and team did a lot of work to make sure that those signatures were what we call scrubbed or verified, meaning that they were actually from voters, or a high percentage of them were from voters. If they didn't qualify under her watchful eye, we didn't turn them in. So, our goal was to get about 1,000 signatures a day for 90 days. And we basically did that. Once you pull out the ones that we scrubbed, that people would literally photocopy the front of it and go get their friends to sign it. Well, that doesn't qualify even if there's 10 signatures on it, because it doesn't have the back. And so none of those, we're grateful for them, but none of those would count. As far as the talking points of the expanded ACA, 350,000 people losing their health coverage, that's not going to happen in Oregon. One of the reasons that we can substantiate that that's not going to happen, I turned in a request to the Legislative Fiscal Office to ask them, what is the revenue from the $5 billion healthcare industry that the ACA represents in Oregon in terms of taxes to Oregon? And in the first round of taxes they sent back to me, we could provide that. Parrish has that document, and so do I. It's about $162 million in the first round of taxes, and that's not talking about the second round where they hire the construction worker and that goes on and on. The healthcare professionals go out and buy a car, create business. Just the first round of taxes creates $162 million, I believe was the figure that they gave us. And Oregon contributes 5%, which is increasing to 6% as we move forward each year. Oregon has to eventually contribute up 10% of the expanded. Well, that for this budget is $252 million. So in what world would you cut $5 billion out of your healthcare industry that brought into the state $260 million that it cost in state taxes $250 million, right? So it's reversed. Actually, that program brings in more state dollars in taxes than we spend in the 5 or 6% of the ACA to make it work. So there's no way that that program's going to go away. So those are just talking points that people are giving to you. But if you look at the financial side of it, which we have looked at very closely, it's not going to happen. There is also a reduction in the caseloads, the reduction of about 55,000 caseloads since the budget was set. Now, they said that they calculated 26% of that into the caseload, but there's still another 20% reduction, or a little over 20,000 caseloads that they didn't calculate. This turns into hundreds of millions of dollars. And so those calculations have not figured into it. And so in effect, if you have this tax on a smaller portion of Oregonians, people that pay full rate for their own health insurance, you will overfund Medicaid. When you overfund Medicaid, House Bill 2391 was written in such a way that that taxing mechanism on healthcare premiums is allowed by the insurance company to be passed directly to the ratepayers, guaranteeing the ratepayers will have to pay for that. And if there is overfunding in OHA, then that bill allows that money to be transferred into general fund budget. Once you start taking money away from the core people that OHA was designed to take care of, people with disabilities, we saw an example on the House floor this year that took ODOT transportation away from seniors and those with disabilities. We saw examples of counting Social Security against their countable benefit, to where they say, okay, if you get Social Security income, now we're going to count that against your federal poverty level. We saw them take $12 million away from kids with disabilities. All of these programs that they're picking away at while they have these taxes and then overfunding it and writing a bill that cost shifts money into general funds, that's where you get pushback from people like me. I support Medicaid. I supported it. I supported the CCOs. I do not support, and I was on the gang of 6 that set these up. I wrote House Bill 3467 that didn't do these things. And if you look at our referendum, we kept the important bases within the funding of the healthcare mechanism that has funded prior. All we did is we surgically removed the taxes to the individuals, the nonprofits, the students, college students, that we believe will overfund OHA and in effect end up being shifted to general fund, which then could go to anything. That's not what we're there to support. We're there to support people that need this insurance and not allow them to kind of water down the people that we're supposed to be taking care of.
I just want to